This is Suze with you on Progresif Radio. Joining me today from JPMC, I have with me Dr. Thomas Matthew and Dr. James Sunny. Welcome.
Hi, good afternoon.
Susan. Hi, good afternoon.
Now, you're here to talk about braces and also orthodontics, which is something I've heard of braces, not so sure what orthodontics are. So can we start off with telling me what braces are and what are the different types that are available at JPMC?
So it's good afternoon to you all. It's good to be here in Progresif. In fact, it's our second visit. And we are two orthodontists from JPMC. JPMC has been into braces since 2005. So braces is nothing but getting your teeth aligned with special devices. Now these devices are normally attached with the help of certain specialized glues, and you attach it on all the teeth, and once that's attached you have these wires that are placed into the slots of the so-called metal braces, and they move the teeth slowly. So the wire is actually the one that's going to bring about the teeth movement, and the patient comes every month and we start seeing the changes. Of course, braces we have in different varieties. We have fixed devices, and we also have the removable devices. In the fixed devices, we talk a lot about braces as such, which is fixed onto the teeth, and it's normally the most conventional are the metal braces or the stainless steel braces. Now that can be made more trendy by having certain colors of your choices and changed every month. For those who are not keen to have metal in their mouth, we do have the clear braces or the ceramic or the invisible braces. Now this is mainly for the adult population who do not want their teeth to be seen with braces on. We also have advanced braces like self-ligating Damon braces that's used for specific conditions. Coming to the removable devices, we of course have the so-called retainers, which does also move your teeth in certain cases. We also have some kind of growth modulation devices that's given to the younger age group, and in certain cases we might need some devices to break the habits, so which is given to the younger age. So this is a spectrum of the various treatment modalities that we have in our department.
I mean, when I think braces, I think the old-fashioned metal braces, and that's it. I didn't realize there was so much choice available. And this is all available at JPMC?
Yes, we have been having it since 2005.
Now, why are braces, or why is orthodontic treatment required? I actually read somewhere that orthodontic treatment can improve a patient's facial appearance?
Yes, of course. Braces is mainly done for three reasons. You can have braces to improve your dental health. So it's suggested that a person who has straight teeth is able to brush better and in fact increase the longevity of the teeth and the surrounding structures when compared to a person who has a crowded or a crooked teeth. So that's number one. You can have braces to improve your chewing efficiency. That means when your upper and lower teeth comes and meets together in a better way, you have a better efficiency in biting, and the forces are considered to be more uniform. Now the third reason which many of the patients come to our clinic is for cosmetic purposes. So I would say that they want braces for cosmetic reasons, to have your teeth straight, and that in fact builds up their self-confidence and esteem. Yeah. So I think among teenagers it's the most wanted reason to have braces.
Now, I don't want you to get mad at me, but I'm just curious. Is there a difference between dentists and orthodontists? Because I thought it was a dentist who did braces.
Yes, an orthodontist is someone who is specialized in the field of braces. Now, when we start our studies, we start with a general dental program where we study for around 5 to 6 years and we become a general dental practitioner. A general dental practitioner actually treats all the common basic fillings, cleaning of teeth, simple extractions, and so on. After you complete your general dental program, you can further study in the field of braces. So we are an orthodontist, then you become an orthodontist. So you have to further study for another 3 years, especially in the field of braces. Now in JPMC, myself and Dr. James, we are the specialist orthodontists. We have also done memberships and fellowships from the Royal College of Surgeons in England and Edinburgh, and also especially in the field of orthodontics. And also we are recognized by Ministry of Health in Brunei. So an orthodontist is someone who is specialized in the field of braces. Yes.
And just going a bit off topic here, I'm just curious, why did you decide to go from being a general dentist practitioner to becoming an orthodontist?
Yeah, so after you complete your basic dental program, you want to specialize in an area. So we wanted to enhance a smile, someone like a smile architect. Yeah, so that's why both of us are in the field of smile enhancement.
I like that, smile architect. That's great marketing there.
Yeah.
So what age can orthodontic treatment be undertaken? Do you have to be like over a certain age to do it, or?
Yes. An ideal age for a first consultation with an orthodontist will be around 9 years of age, where we can assess the development of the teeth and also the development of the jaw. So if there is any issue with the development, then a simple interceptive type of appliances can be done to correct those issues. Now, if you are looking for fixed braces, then an ideal age will be after all the permanent teeth are erupted. Normally, it is around after 12 years of age. So an ideal age to do braces may be during the adolescence, maybe after 12 years up to 21 years. But even for adults, the braces are possible, provided their gums and teeth are very healthy. Yeah.
Now, is there an age limit for getting braces?
Oh, no. I think anyone who wants to have a good smile, yeah, they are ready for braces, yeah. But there's certain criteria we look into. We just don't go by installing braces straight away. We need to go by taking, the models of the teeth. We go by x-rays, and of course we look at all that into when getting a treatment done. Having said that, if an adult has a good set of teeth and the bones are healthy, why not? He or she can have braces. It's only that the treatment could get a little longer when you are in your adulthood, because the bones are considered to be more denser. So when compared to a younger age versus an adult, the treatment can get a bit lengthier. Yeah.
But I think it comes back to what you said earlier. It's about the self-confidence. So if something like that will help an adult.
Of course. And these, we would say that in our practice, we are around 20% and above are adults. So that's, the trend is changing. It's not, the days are gone where it was only the younger age groups coming. So nobody's shy to have braces on, yeah.
It's become a cool thing.
Correct.
So now, you were saying it takes a different amount of time. So how long does the treatment actually start once it's commenced?
So that's one of the drawbacks, I would say. It's not a drawback, but patients who come for braces, some of them, they want overnight correction, which is impossible. So we look at the condition of the teeth. If it's a very mild case where you just need a minor alignment of the teeth, it normally takes just over a year. But the more complex the case becomes, where you need to pull out teeth and things like that, you might need to have it more than maybe 18 months to 24 months. So, but an average, if you look at it, is around 2 years. Yeah.
Now, I always thought that braces looked quite painful. Is the treatment painful to have?
Of course, we cannot say that braces won't bring any pain. But of course, it's not, again, we cannot just say that just because of pain, you shouldn't have braces. When we look at the way the teeth moves, it's a lot of involvement of the tooth moving against the bone structures. Yeah, so there's some amount of pain. However, this pain could be considered between mild to moderate. And if a 12-year-old can accept that pain, why not an adult? The pain intensity, of course, is not throughout. So that's a good news. It's mainly on the day of the tightening, and it might last for 3 to 4 days, and then the pressure buildup goes down. And since the appointments are every month, by the second week, third week, the patient has no pain. But on the day of appointment, when we tighten or change wires, again, there's a slight pain happening. The pain also could be a little bit more when you have it removed on the last day of braces. Other than that, it's all well accepted by everyone.
Well, I mean, it's like you said, if a 12-year-old can manage,
yes, of course.
why can't anyone
correct,
else?
Correct, yeah.
Now, is there a waiting period to get braces? I mean, could I just come into JPMC and say, right, doctors, I'd like to go ahead and get braces? How does it work?
Yeah, there is no any waiting list as such, but I would like to explain to you how the braces appointments are. So when you come into JPMC for a first appointment, we do the examination of the patient, and as well as we have to take some mold of the patient, especially the measurement of the teeth, and also some x-rays. Now with these x-rays and the measurement of the teeth, we need to do some planning. So that happens in the next appointment. Now once during the treatment planning, when there is a discussion going on, there may be need to remove teeth for gaining space. So if there is need to remove teeth, then that have to be done before the braces is done. Yeah, and also in some cases we have to do cleaning of the teeth, and also some fillings have to be done. So these all have to be done before we commence the braces. So normally this takes around few weeks to up to a month. So you can expect maybe around a month to start with the braces.
And just to start and get ready. Now, what happens if someone has bleeding gums, which can happen, or even decayed teeth? Are they still able to have braces?
Yeah, it's very important to have healthy teeth and gums before we start the braces, mainly because the braces treatment is a long treatment. Normally takes around 1.5 to 2 years or even higher to complete the treatment. So we do not want any issues like pain or bleeding gums in between the treatment. So it will be ideal to get those things sorted out. So by proper brushing and also by cleaning, and then we can better to start the braces. So in JPMC, we give a lot of emphasis for an overall oral health than only just getting the braces done.
So when you've got braces, is brushing your teeth different?
Yes, it's a bit more challenging to brush with the braces on. As you know, the braces are fixed to the front side of the teeth normally. So there will be a few wires going around it, and also some rubber rings. So it's going to be a bit more challenging to clean with the braces on. But we do help and guide the patients, especially they have to get some special brushes like interdental brush and orthodontic brushes, which can help them in cleaning. Yes.
Now, I think it was a couple of years ago, there was this big trend. Well, I don't want to say trend because it was a negative thing, of fake braces. And just for anyone listening out there, obviously you shouldn't be having fake braces, but what are fake braces, and are they particularly harmful?
So I think this has become an emerging trend. It started with our neighboring countries like Thailand and Malaysia, and it's been coming to Brunei, but we also are trying to advertise and also give awareness to the public. So fake braces, as the name suggests, it's also considered to be dangerous, or we could say it's also known as cheap braces, where the treatment as such is provided by an unauthorized personnel. So we do not know who is this person. It might be just a person who has been trained from YouTube, yeah, and it's always in the hiding. But what happens is, with this untrained personnel, the treatment mechanics and the materials used are all of inferior quality. So apart from the wrong mechanics and the planning involved for treating the case, there are also complications associated with it, which could be you could have the teeth mobile, you can also have a lot of bleeding gums, you can have a permanent damage to the tooth structure, and in certain cases it can be so bad that it's irreversible. So if they come to an orthodontist at a later stage, it would be too late. So we are totally against this. Of course, the Ministry of Health is also taking strict action. And I think the public have to make that awareness that it's a definite no to fake braces. Yeah.
Now, here's the big question. So if I were to come to JPMC, I've had all my appointments and I'm all ready to get braces, how much would it be for me to get them done?
Yes, this will depend on each case actually, but our treatment package starts around $2,500 and upwards. But if the treatment is more severe and long duration treatment, then the charges will be a bit more higher. But the patient can definitely pay by installments, which is $300 per month for the first 6 months, and then $100 till the package is completed. So this package covers all the treatment for the braces, and also the retainers are included. So after the braces are done, it's very important to have retainers to maintain the teeth in the correct position. So those retainers are also included in this package. Now in JPMC currently we are having a braces promotion along with the Standard Chartered credit card. So if you want to know more about the exact treatment costs, it's better you can visit us and give us a call in the dental clinic. Yeah.
So for the braces promotion, you're collaborating with Standard Chartered Bank, and that's exclusively for SCB credit card holders only. So for more information, you can follow them on Facebook and Instagram at JPMC Brunei, or to call your dental clinic for an appointment at 261-1433, extension 2229 or 2114. Well, thank you for coming in today, Dr. Thomas and Dr. James. It's been very interesting because I've learned a lot.
Yes, it's been a pleasure to come over here, especially the ambience. Yeah, we feel very relaxed, and it's good that we can also give the public an awareness about what braces is all about, and of course with our new promotion.
So the promotion, as you said, is running until 30th of November 2020. Thank you very much.
Thank you.
Thank you.
Good day.
Yeah.